glad you could join us tonight. We got a special guest by the name of Randy Crawford. Randy is president of Restor Metabolix, and he will be speaking to us tonight about the treatments that are to do with diabetes and some of the successes there, and what light can do as well, what photobiomodulation can do.
Hello.
Well, hello there, Randy.
Hi, it's good to see you, Tom.
Yeah, so tell me about your clinic or your clinics and where you hope to go.
So we are a company that started about 4 years ago. We found a treatment that we were able to use just over-the-counter insulin and a pump to deliver, great results to our patients. We figured out some timing things for, to mimic what the pancreas does, or very close to what the pancreas does. And we've had really good results. We also have had patients that we have had a harder time getting into the range that we would like. There are patients out there who just totally eat the wrong things and they're just overworking their pancreas. And then there are people out there who truly are truly insulin resistant. And what we found was those that are truly insulin resistant, they are incredibly hard to treat and to get into a good range. That good range being somewhere between 7 and probably 7.5, to make sure that they are going to do well for a long time. So we met Tom probably 2 months ago, maybe 3 months ago. My partner Jeff met him at a Maha event. And the outcome of that was Jeff coming back and said, "Hey, Randy, I want you to meet Tom and just take a look at what we've got." That led to some studies and stuff that we were kind of finding and looking for. And we ran across a study, and I don't have it with me tonight. I'm sorry, but we'll make that available through Tom a little later. And we found out that the patients that did not have diabetes, let's be clear, they did not have diabetes. They underwent a red light therapy for 15 minutes a week in an area about this size, 20 by 20, which was put onto their back for 15 minutes. And what they found over the next week was that their postprandial blood sugar had decreased by 27%. And what that means is the blood sugar after they eat, 2 hours after they eat, which is normally, let's say, if your blood sugar is 190, 200, 2 hours after you eat, which is a little high, but so then the patients who underwent the red light therapy, and these patients, again, they were not diabetic. So they saw a 27% decrease in their blood sugars over that time period.
Would that be at the 2 hour time point then?
That is correct. That is correct.
Okay. All right. After they ate something.
That's correct. And so that kind of sparked Jeff and myself into, hey, if that happened with a patient who does not have any problems, they don't have diabetes at all, and we see a 27% decrease in their blood sugar, and that's lasted, 5 to 7 days with one 15-minute treatment, what would it do to a patient who had type 2 diabetes?
Right.
And so what we did was we met with Tom, and the three of us met. We've had several conversations since then about what happens and what we're seeing and different things. So the bottom line is I bought 2 of the Palm Ultimates, and Tom was just demonstrating those earlier today. You can see that it's basically the size of a shower head. And what I did, not 20 by 20 like was in the study. Okay, just know that.
This is 3 inches diameter. Yep.
That's correct. And so what we did was I said, well, I'm just going to put them on my patients and see what we was going to do. And so Tom suggested that we take 2 of those and kind of mount them together like this, so we get a total of 6 inches in diameter on those. Well, my brother, this may be a little TMI, but my brother had to have back surgery.
Okay.
And I said, my brother's got to have this so I can get him back up and moving quicker. And so I sent one of them to him, and I told him how to use it. And he actually went back to work 2 weeks earlier, and he's feeling great. He has no problems with any problems at all from the surgical side, any back pain, no leg pain, nothing. Everything's perfect. He liked it so much, he told his wife about it, and she actually started using it on her hands for arthritic pain. But nonetheless, that's the whole side. So bottom line is I've got one of these in my clinic, and I move it from patient to patient when we're treating. And so now, with just one of those palm ultimates in a very small diameter of 3 inches, we're seeing patients who have truly, truly tough blood sugars that are high A1C and high insulin resistance, be able to move them down lower than what we can just with our original novel treatment period. So that's it in a nutshell.
Wow. Wow. So just for those that are looking, this is the one he's talking about. Now, this is not like any common light source or PBM device or red light therapy. There's a lot of power coming out of this device. You can see it going right through my hand here. So no wonder why, when you got two of these guys going on your forearm or somewhere, you're treating your blood, no problem with that. And we have a lot of optical power coming out of this unit. As a matter of fact, there may be even a chance that your big the 20 by 20 panel that they're using, this probably has more energy coming out of it than that because it's very, very intense. So it's possible to get some pretty decent treatment of the blood with this. And Randy, I remember, I think I shared with you that one woman we had come in here was with my older technology, the old chair style that I had. And she had lost one leg to diabetes already, just below the hip that they removed her leg. And the second one was now discolored, and they were talking about, possibility of that being amputated soon. And she also had diabetic because of the eyes, retinopathy, and bleeding in the eye. And so she came in. I didn't really know anything about the eye condition, but we weren't treating her leg. That was the interesting part. She was just sitting in the chair treating her back. And after 3 treatments, the color returned to the leg that was going to be amputated. That was, first of all, really super for this woman because, hey, possibility of not amputation. But the other thing was, we had the part of it was her bleeding in her eyes. She's had it where they do the laser cauterization in the back of the eye because of the bleeding and that occurs because of the diabetes. And she had the laser done a couple times where they had to stop the bleeding. And so every time she'd have to wait 5 weeks before she got the treatment when she called in. And in this case, she just before she had the light treatments, she had checked it out with the optometrist, I guess, and said, "Look, you got bleeding. It's happening again." And she could tell because her eyesight was going downhill. And so she scheduled another treatment or to go in to see the specialist to get this done. And when he saw her, this was after about 2 weeks after the last light treatment that she did. And he says, "You got no problem here. Your eye is totally healed." The bleeding had stopped and healed properly.
It's fantastic.
So we were treating, she was sitting in the chair, so we were actually treating the back, not the eyes, not the leg directly, but obviously it had an influence on the blood. So, and I think that's where you're seeing is that you're seeing changes in that are affecting the blood somehow.
Yes, that's what we think. Our data right now is anecdotal and sporadic with patients. What we're doing is we're trying to have enough anecdotal evidence to kind of put together the study that we can definitively prove this. So our next step or evolution here is we're going to take 10 to 12 patients from multiple sites and use these patients to prove this out. And we'll have all the criteria. We'll have IRB done, and all of it will be
Right.
top notch. But that way we can say, okay, yeah, we saw some evidence of this improving, and this was the only thing that we changed. So that's really our next step and where we're going. We're very excited about it, and what can happen. Everybody knows with diabetes that it attacks the kidneys and the eyes, because that's where the tiny vessels are. And that's why when you see your doctor and they say, hey, we got to put you on an ACE or an ARB, that has nothing to do with, quote, the blood sugar part of it. It has everything to do with protecting those tiny vessels in the kidneys and in the eyes. Now, the kidneys are very high pressure organs, so about every time every time your heart beats, basically 25% of that blood flow goes directly to the kidney. So there's a lot of pressure going in there, and we have to protect those small arteries because diabetes really damages the arteries. And then when you look at what it does, LDL-P, LDL-C, when you look at those things and you start tracking what it's really doing with your cholesterol, it gets really out of hand. One of the great things with the red light therapy is that what we think we're seeing is it's causing angiogenesis, which is the forming of new blood vessels. And if we can see that in the eyes or in the feet and legs, especially, so that these patients with diabetes get a better blood flow, that is a tremendous advantage for those patients, because once they lose part of their limb, it's only a matter of time, typically, before they lose another part, and you can start the clock on how much longer these patients are going to live on average.
Yeah,
So
I
it's
understand
very
that.
important.
Yeah, I understand that patients, once they start losing getting these amputations, they don't want to live after that. Like, that's another problem, right?
Well, it's not. I don't know about the want to. I'm sure that contributes, but just the mere fact of the process has started, and you typically see a toe or a few toes, part of the foot, the whole foot, below the knee, above the knee. That's typically the sequence of amputation, and it's because those arteries, the further away from the torso or the heart, the smaller they get, and the easier they are to clog or to have problems. And
Right.
so you really want to make sure that you've got good blood flow and good with the red light. What we think we're seeing is new vessels forming, and so that allows better blood flow to those extremities, and that certainly protects the patient, and it helps them live a lot longer.
Here's a picture of a person that had a diabetic foot ulcer. I wished I could have brought it up directly on the screen, but for now, for those out there, this foot was going to be amputated in 1 week, was scheduled. And anyways, 1 week. And so they rushed in one of my Palm Lights, and through the sun went to my church, and then they used it for a whole week undercover. Basically, the hospital didn't know about it, and this is in Alberta, Canada. And so 20 minutes a day she used the treatment. Well, at the end of the week, the surgery was canceled. This is in 2 months. She kept it up. That's in 2 months' time that healing had taken place, and another 2 more months that was totally healed, that foot, and it saved the foot from being amputated. She was able to walk again on that foot.
So, so Tom, this is Jeff. Sorry
Hey,
I'm late.
Jeff. Yeah, do you
Hey,
want to bring on your
you're in
video? Do you want to bring on your
well,
video?
I'm driving right now,
Oh,
so I
all
do
right.
not, because if I
Okay.
have a wreck in Atlanta traffic, I don't want that to be Exhibit A. So no.
Oh.
But I'm
Yeah,
15 minutes from
never,
home.
never mind that. I'll have to take some
Yeah.
gravel maybe before the end of the.
Yeah, but you'll get to see my pretty mug in about 15 minutes.
Oh, all
But
right, okay.
to your point there, Randy and I believe strongly in combination with red light and our therapy, because we also see vascular improvement with our patients just with the IRT infusion treatment. And so we're healing from the inside out, and you're outside in.
Yep.
And I think you're going to see that 1-2 combo that thing may have even healed even quicker, because you're also those cells are metabolizing sugar more efficiently, so it's going to heal a little quicker.
So
I mean, we see wounds heal up. It's crazy.
yeah.
So
one of the
go ahead,
things, Tom, that we know the red light is doing, or we think it is doing, is that it increases either the efficiency or the production of the mitochondria. And so by our treatment, how that works is we unlock the cell so insulin can get into the cell. Therefore, it can, through the GLUT4 process, it opens the door for the glucose or the sugar to come into the cell, and that gets to the mitochondria. Well, when you're using sugar for energy, it's a very efficient fuel source versus fat, which is a very inefficient fuel source. So you get 12 times the ATP or energy production by using sugar than you do using fat. And so we see this with just our treatment, but it really is enhanced, we believe, with the red light therapy and the products that you're producing.
I want to take a moment here to mention too that in the future, you're looking at in the next couple of years opening up 200 clinics, correct?
That's correct.
So for anyone out there, we have quite an audience here tonight. Anyone out there that would like to see the future of this move forward, what Jeff and Randy have come up with, they will have a protocol. They'll have everything set so that this could be a treatment center or a treat. It could be just solely for this purpose of helping those with diabetes. Correct? That's what we're looking at. You're hoping to do.
That's right.
We see benefit in the blood pressure. Actually, we see the blood pressure go down first. We've seen. We did a small little retrospective study with Mercer, and we saw a 17% drop in blood pressure in our patients. 17%, not 17 points, which is a big deal. For example, if you could move 10 points on the blood pressure, you can get a new drug through the FDA with almost no problem. So we moved to 17%, and we're not even going after blood pressure. We're just working on diabetes because we know if we fix that, the rest will fall in line. We've seen blood sugar, obviously, A1C improve, HOMA-IR improve. The things that I like, because I have a cardiology background, is the lipid panel improves, the total cholesterol, the LDL, the LDL-C, the LDL-P. Those things improve. We really are excited about where this is going once we get it all put together, and we're very close.
And the EGFR and creatinine also see some too.
Wow. Yeah.
And so also our
kidney function.
That's great.
Our coverage is also into other countries as well tonight. So if you're in another country like Canada or other locations, I'm sure you guys are probably going to open up once you get this all approved through the system and a study behind you. But do keep in contact with us, and we'll gladly connect you guys with Randy and Jeff and their incredible work. So curious, so you've been able to see wounds heal as well, but unhealing wounds probably getting healed through using your process. My gosh, if you put the two together, that's got to be a home run.
That's when I met you at that Maha deal up in DC. I called Randy and go, "Am I crazy? What do you think of this?" And then we called our endocrinology buddy, who's and he also he did his little research thing. He goes, "No, I think y'all are onto something." So anyway, so it'll be interesting to see how things prove out. But everything's trending in the positive direction. It's exciting.
Well, we will also be having questions after our short break. We're going to open it up to questions in our chat. So for sure for that as well, people that are listening in tonight, please, type in your questions and we'll try and get them answered. But we still want to go over some stuff first, some other really cool things that is happening. So with the light, you did the back pain, and Jeff, you probably have a story or two about the light yourself. you want to share with the audience?
Absolutely. Randy, you want to go, or have you shared your
I've
stuff?
told him about my brother, and I think he wants you to tell him about your arthritis and stuff in your hands.
Oh yeah. So I'm a ex college football player that's been beat up pretty good, and I broke my right thumb, the joint, the bottom part of the joint, back in college, and cracked it. Anyway, it's been flaring up significantly, and I've been using the red light for that. And then from a tennis, hate to say, from a tennis injury that I had about 20 years ago on the wrist in that same hand. But when I put that red light and then that near infrared on it, it relieves it 100%. It's been really interesting. Also, another thing that I found was kind of interesting is as I'm a 61-year-old guy, things start growing on your skin that you had never seen before. And anyway, some little, I don't know what they are, those little, I call them
Abnormal
live
cells.
bumps.
Abnormal
Yeah,
cells. How's that?
around my neck. But since I've been doing this red light therapy, those things have gone away. And I don't know what's really causing that. But,
Yeah,
I do believe this light, obviously, wherever you put it on, is resonating like fiber optics throughout the entire body. And I think it's doing some really interesting things there. So
yeah,
but
we had to censor the bad C away from our presentation because we've been censored already, and even though it was as accurate as could be, they didn't like us saying that there was something that could help with the bad C
yeah,
situation.
right.
On so and
Yeah,
there's tons of studies that prove this particular aspect of but no, we had to so I can't talk
yeah.
about that.
Can't talk about that one. I gotcha.
Yeah.
Well,
So, and other psoriasis and other types of skin eczema that we've been able to see. One fellow with bad psoriasis, I mean, he's 80. He just celebrated his 80th birthday. Well, he had psoriasis already in his 20s, really, really bad. And so his skin was so bad on his legs. And here he gets to meet me this summer just before he's 80 years old and starts using it on his legs. And his skin, he says, I cannot believe it. He'll be one up on my webinar coming up because he cannot believe how much his skin has improved from all those nasty years of being under trying to do all sorts of treatments. And he'd be on certain drugs that would help, but still he'd have these issues. Well, he was in the hospital in his 20s for a month out of every year because of his psoriasis condition. And then finally the one drug came along that helped him. But yeah, he's so happy with the results of what he's getting. But that's a skin issue. That's far away from what we're talking about right now. But different
All
skin
has to do
issues
with
can,
blood flow.
yeah. So so we've had that, and but I'm so encouraged by what you guys are doing, and I hope this word gets spread out there pretty far and wide that there's some hope here that you guys give.
well, we think where we're focused is going to be on the wellness side and these wellness clinics while we get the code where it can actually Medicare, Medicaid, and private insurance will pay for this. But
Well, there's all sorts of like if you're able to help get the blood sugars in control, you start talking about it, Randy. There's a whole host of things that are improved upon.
That is correct. That's correct. I mean, they talk about there's 88 million people with type 2 diabetes and pre-diabetes, but that number that is really could be affected by what we're doing with the two treatments could be well over 100 million because of especially in the southeastern United States. That's a heart attack and stroke belt of the world. And so we, it used to be called the Bible Belt, and I make fun of it all the time because I live there and I'm one of them. I call it the biscuit belt now, and it's just gotten out of control. The diet is just out of control. And so, and I mean, there's a lot of socioeconomic factors that go with that, and a lot of different things. But we've got to get to a point where we're feeding our body for fuel, not just for fodder. And so we've got to look at it a different way from the diet side as well. But until we can get all those things in place, which is going to take years, the red light along with our RT is seeming to put us in a good spot as a bridge. We'll say it that way.
Now, Randy, on some of the people, do you mind sharing a couple of the stories of some of the people that had the light therapy? One you mentioned about the neuropathy. Share a few of those anecdotal situations that you.
So I got a patient. He's 67 years old. He's a quote retired accountant, but he's absolutely not retired. He drives about 65 miles one way to see me every week. He comes in, he brings his laptop, he sits down in a chair, we start his IV, we do the whole thing, and we put he has peripheral neuropathy due to his diabetes. And it has improved since he's been with us, but he is one of those patients who has a very, very high insulin resistance score. And so very much improved. Obviously he is, or he wouldn't be driving 65 miles one way to see me. But what we do is we take that, the palm red light, and we just drop it right. So when he's sitting down in the recliner and you got your feet sitting out like this, we just sit it right on top of his ankles.
Okay.
We don't have to take his shoes off or anything like that. And he's seeing great results so far. He leaves and he's pain-free, which he cannot say that at any other time except when he's there with us. And he's been on all the medications, the Lyrica, the we'll obviously start with gabapentin, then the Lyrica, and whatever else. And so he's done really, really well, and he's very active as well. He does not want to not be active. I mean, he's got a great life. He works as much as he wants to do. He plays golf. He's got his kids and grandkids, his wife, and so he's very much looking to continue to improve. And we think we found something that's helping. The second patient that I want to talk about is actually I'm a nurse practitioner, so I have an overseeing physician in the state of Georgia. I have to have one. I've been doing this a long time, so we don't have to have a whole lot of conversation, but he's a great guy. And I actually treat his wife, who is a severe diabetic. She is 5'7" and she weighs about 115 pounds. So when you look at her, you would think, and the way she eats, she is impeccably disciplined, incredibly disciplined. The way she eats is just perfect. But her blood sugar, due to the other problems with her pancreas, she's type 2 diabetic, and she is incredibly insulin resistant because she's been on it for so long. And so she'll come into us once a week or twice a week sometimes, but basically once a week. And her blood sugar will be 400. I mean, that's nothing that we even are concerned about with her anymore. When we were just using the RT, we were able to get her down to 200, maybe 180, and she was ecstatic about that because she can't get that low on her own. And so we're able to do that, and she's on all the appropriate meds. She's on all the standard of care stuff. We're not doing anything that is outside of what the ADA says, and as far as standard care for medications and all those things, all of those things are already in place.
Right.
Still can't get there. So when we come in and we put our piece on and she gets closer, she was very happy. And so I said, Miss So-and-so, I want to try this. I don't know if it'll work for you. I don't know. I'm just trying to see what's going to happen. And she said, I'll try anything. I said, okay, so we did. And so the first week, all I'd had her do was just put it right here on her arm. You straight to the skin, not through a shirt or anything, but straight to the skin right here on her forearm. That's all we did. And we were able to get her down into the 140s that week. She was incredibly happy with that. And when she came back the next week, she said, Randy, my blood sugar stayed lower on average than what it does typically. That was the first week.
And that was adding the red light. And this is a patient or a client that you've had for a while.
20 minutes.
I've had her for 4 years. She was the second patient I admitted. She's my overseas doctor's wife. So
So
Yeah.
you got the
I
baseline.
know her as
Yeah.
well as I know any patient in my practice.
Yeah.
Absolutely.
It's all anecdotal at this point, but we are full
But
steam
I'm telling
ahead.
you, she is absolute, and so is the other patient, who's a male patient that I just told you about. So she comes in the second week, and we try it again. And so this time I said, Miss Graham, oh, sorry, Miss So-and-so, would you please just try it on your abdomen. Let's just see if it works, just putting it over your pancreas, if we get a better deal or not. So she slides it under her shirt, and she has a camisole on underneath her shirt, and nothing happens. 30 minutes with light, 20 minutes usually, but 30 minutes this time, nothing happened. Okay. And so I was working on some other stuff, and one of the nurses came and got me. She said, Randy, Miss So-and-so is not happy. She's upset because she had so much hope in what she'd seen last week. And then this week, we didn't get the same result because we're still over 200, and we're at 2 hours into our treatment now. We're fixing to have to let her go 2 hours, 15 minutes, 2 hours, 30 minutes. I said, okay, so I'm coming to talk to her. And so I did. So she told me what happened. I said, well, I'll tell you what. This time she's around 200-ish. I said, tell me what's going on. And she said, I said, well, okay, well, tell me what you did. And she said, well, I slid right under my shirt, and I noticed she had that camisole on. I said, did you put it directly to your skin? Well, no. I said, put it directly to your skin above your pancreas, on your pancreas. And so I said, and we're going to check back in 20 minutes. She was at 114.
Whoa.
Feeling great.
So
And
this
I'm just telling you what I've seen in my clinic. And if you call me, I will put you on with the patients that are telling you this.
they're fighting over your red
Yeah.
light therapy.
Oh yeah. Yeah, they won't.
If you go over your 20 minutes, they're getting ready to fight.
Yeah, you get an evil eye. So
Well,
they will make sure they get theirs.
you just have to get some more units for your.
And we're working on that too. We're working on that too. So let's hold tight. And so
that is cool.
And
I
then
think
the last patient I'll tell you about is
Yeah.
my dad. And so you may know a patient like this. So my dad is 72 years old. He has the only problem he's ever had is it was cardiac related, and he had triple bypass at 50. He's been on blood pressure medicine since he was 30. Okay, he had no signs of diabetes whatsoever.
Okay.
He wound up with renal carcinoma, which is kidney cancer, that actually spread into the spine, so stage 4, and we had to do a lot of different things to get him covered and seen about. And so he underwent all the traditional treatment. Here we go with our, whatever it was, 10 weeks of chemo and then 10 weeks of radiation and then all
Standard of care.
Yes, standard care. And then we came back after all of that, and we started on the immunologics, which the particular medicine that he was on was Keytruda. And he told me, Randy, this is killing me. I don't want to take it no more. I'm not going to take it. I said, well, Daddy, we just need to. And so I talked him into it, and he stayed on a few more weeks, and he said, I don't care if I die, but I'm not doing this. And so in the meantime, he comes home and he's telling me, he said, I am thirsty all the time. My mouth is dry. I'm thirsty. So, Daddy, I don't know what's wrong with you. I mean, drink some water. I mean, we live in Southeast Georgia where it's hot and humid. On our best day, it's 85% humidity on the best day of the year. So it's always hot and humid. And I said, Daddy, just drink some water. So I never seen that he, that this stuff had destroyed his pancreas and his thyroid also. And, oncologists should have been looking at that. I thought, well, anyway, so when he told me that, I started doing all the workup and found out that his pancreas is gone. Totally makes no insulin anymore. Zero. And so for a 72-year-old overweight cardiac redneck patient, and I can say that because I am, that will not listen to anything and is going to do exactly what he wants regardless of the consequences, to have to deal with this type 2 diabetes at his age is almost catastrophic. It's almost been catastrophic for me because it's been a lot of work for me because he does not want to listen. But bottom line, so I put him on all the best stuff. He's got a Dexcom G7. He's tied on to the Omnipod, so we're making sure he's getting plenty of insulin, all these different things. And so no matter what he does, he's going to be 300, 400 after he eats. He's just going to do that. So he comes in and he's shooting his mouth off about what he ate that day at the country buffet, which was lima beans and rice and everything that you should
Everything you shouldn't eat.
never
Yeah.
even come in contact with. And so he's like 350 when he gets there. And this is on an Omnipod that's running automatic that immediately diagnoses and dumps more insulin as soon as it needs to. And so he's 350 when he comes in, and we sit him down. I'm like, okay, so we get him started just like we always do, and we can move him down pretty good into 170s, 150s most of the time. And so we put the red light on him, and he was 89 in about 20 minutes.
In 20 minutes.
20 minutes, and we had to take it off of him. I had to stop my infusion, and before he got out of there, he also dropped on down to 51.
Where did you have the red light? Was that on
his abdomen over his pants?
Okay. All right. Gotcha.
So I'm just telling you what, and I've done it on him 2 or 3 times now. So I'm telling you what I'm seeing. I'm not swearing that it's all red light. It could be an act of God. It could have been some bad cheese pizza. I don't know. But I'm telling you that the patients are absolutely wanting the red light on them every time they come in the door. They are seeing a difference in their blood sugar while they're in the chair with us. We're tracking that. We're also going to start tracking what we see on their CGM over the 7 days that they're gone from us. And so maybe we can have a follow-up webinar in 2 months or so, and let's catch everybody up on where we are. But I'm telling you, it's phenomenal what we're seeing, and these patients are not just cherry-picked patients that I'm telling you about. These are some of the worst patients. Not when I say worst, well, my dad is the worst because he's just not going to listen. But the other patients are great people, but they just are hard to treat because of their diabetes. And so we're not. I mean, I'm not even telling you about the normal stuff. That's just that's working. So anyway, so I just want you guys to know, again, it's anecdotal at this point. We're not saying we're a cure. We're not saying any of those things. What we are saying is we do think that we can provide some hope.
Wow.
And we have that.
Yep. Amen.
Yeah. So I tell you what, I just want a few minutes of a commercial right now. And then we're going to go into answering questions. So everybody who's on tonight, think of your questions to pose to these guys. My friends, and we'll start answering them. So we just need 2 minutes. So if you want to just turn off your videos for a second, come right back in, that'd be great. "15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about 1 foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications
where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So to accomplish what you saw there, we have three devices. We have the Palm Professional, and then we have the Palm Ultimate. Both of those have the 660 wavelength, the red that you see here, and you can see the penetration going right through my hand. And it has the 810 nanometer, and the 810 doesn't look very impressive. But if I put that on my hand here and I put a power meter on this side of my hand, I'll be reading 10 to 30 times more power coming through my hand than the red wavelength. So that is the two palm lights. And then I have the Super Palm, which is the 810 and 1050 nanometer. That's this guy here. And it is, let's see, yep, it has the 660 nanometer and it has 1050. Now, right now, you just see that there's the one red light, but then there's the purplish lights here. I can't see those at all when I'm looking at it, totally invisible to the eye. It's possible that that can actually penetrate a bit deeper with this light, and we've seen some really neat things with the 1050 nanometer. Then we have our helmet. The regular helmet is the 660-810 nanometer wavelengths. So this just goes like one of those old hair dryers. And here's the red light wavelength right now. And people do 1 minute of that and 3 minutes of the near infrared, which you can barely see. It's just some little bit of purplish there. But this is the one that we've been able to see all sorts of improvements for cognitive issues, whether it's strokes, concussions, Parkinson's. We've seen some improvements for autism, traumatic brain injuries, depression, anxiety. There was even a study done on opiate addiction and depression that if a person goes on my research tab, you can go down the tab down to, or go down the page to PBM 2024 and see the research study that came out on using light therapy. And that our helmet, and that was 1 minute red, 3 minutes near infrared, and in that there was 1 minute red, 3 minutes near infrared, and they did only 2 treatments a week of that. And there was significant reduction in depression and anxiety, and other the desire for opiates, the desire for drugs, and a bunch of other factors that showed that the people that were undergoing under the light therapy did much better than those much better than those that didn't. So it was amazing to see the improvement that these people, and that was 2 months of treatment time. How much difference can we make in people's lives if this was going on, across the US and Canada? But the whole thing is these type of devices are able to reduce inflammation. And anytime you can reduce, that's just one of the side effects. The good side effects of these devices is the ability to reduce the inflammation in whether your hand for arthritis or even helping with tinnitus. But on the brain, a person can use the palm. It just takes a long time, whereas the helmet is 10 of those. So we have this device. It's 10 of those for $6,500 for this device. And right now, and we have as well is this turned on? Oops. Okay, there's the red wavelength, and here's the near infrared wavelength. This is the one, the mini canopy. Now, again, the amount of optical power that comes out of this thing is huge. It's basically 15 times the area of the palms and 12 times the power of one of the palm lights coming out of this device. So this treats a much larger area of the body. So that's our three devices or several devices. We have some more even coming in on for other oral mucositis for doing inside the mouth. We also have a probe that can go on to those things. Look at our website. I will say also go to our YouTube channel, www, sorry, not www, www.SunPowerLED is our website. But also, if you like to go on YouTube, please like and subscribe on our YouTube channel, because what happens is YouTube takes those things and says, "Hey, people like watching this thing," and it helps us to get to a much larger audience. So please go to my YouTube channel and subscribe and like. So now what we'll do is, and also anybody want to buy this, if you want to go and use the code, the coupon code of webinar 10, you'll get 10% off tonight over the next 24 hours. So please go ahead and do that. But let's answer some of these questions. Okay, so I got a bunch of questions here. Ron is thank you everybody for asking questions here. So Ron is asking, where did they place the light on the diabetic patients? Well, I think you answered that, but go ahead, Randy. You want to mention again?
It's on the pancreas. And so there's another question a little further down. So the pancreas is on the left side, right in this area, right below your rib cage ish. You know, everybody's different depending on how big you are. But this is the area that we're putting the palm red light and the you know, the other one, the what you call it, the near infrared.
Near infrared.
Right here, just right here, right under the rib cage.
Okay.
Now,
All
for
right.
the peripheral neuropathy, we're putting it straight directly on the feet, and we're seeing good results there too.
But we've also seen it on just the forearm.
Oh yeah, we started out just the forearm right here. Right?
So
And
just putting the light like that, and
That's
in
correct.
your case, you actually doubled up. You had used two of them, but
no, just one.
just one. Okay,
Just
all right.
one.
Yeah.
So that's how the guys were doing it.
Yeah, and I don't know where that study is, Randy. I'm not in front of my computer, but there's a red light study that was done on I don't know. What's that?
The non-diabetic. Yeah, I mentioned that.
The non-diabetics, which that's what got our brains clicking about why this might help. So anyway.
Okay.
Yeah, and so we're thinking, because when they come into the clinic, they're usually they're in their work clothes. They got long pants on. Most of them do. Some come in short, and they got their shirt on. So we're going with the forearm's the easiest thing. Plus, we're setting IVs, and usually that's either on the hand or somewhere up and down the arm. So.
Right. I just thought of something too. Although it depends on when you go into the hospital, depending on the nurse who you get, how easy they put it into the vein. But
It also depends about 95% on the patient. I will say that, and how hydrated they are.
Oh, really? Okay.
Yes, sir. Because if you got a flat vein, you're not. You can get it in there, but you're going to have problems. So it's not just the nurse. If the patient is not doing what they're supposed to do as far as drinking water, which is key with a diabetic patient, and not soda or Diet Coke or whatever, or sweet tea in my case with my patients.
You mean really? You mean
I'm just saying. You must be hydrated so that you can actually thread a catheter into those veins. So we're not going to throw the nurses under the bus. I got to stand up for all those girls.
All right, but the one thing I was thinking of is if there was any soreness, they could use the light as well and reduce any soreness from that. That might be useful. So there's a couple people that have asked similar questions. Okay, so a question about the back, and I can answer. Can you talk about best practices for using the palm on the lower A1C? What is the best way to treat? How close to the whole? Okay, and how long to treat red light and other? Okay, so if this was my spine, you would sorry, there's different places, but anywhere on the body, you said A1C, but I was going to talk about the spine. is I'm suggesting you put this right against the body. The only reason you might want to pull it back a little bit is if you're feeling that it's a little bit warm. But what's going to happen is as you could see, as I pull it back, I'm still doing a decent treatment. It's just treating a larger area. So you can put it on there directly. You will find, I always recommend the person uses the red first because you get vasodilation that happens with nitric oxide. So you're going to have the blood flow through the area. You're treating the blood. The 810 or the 1050 can go deeper with that setting. So you can, that's the one usually, if you're trying to treat, let's say, the spine, I'm going to say you spend about 5 minutes with the red, the bright red, and maybe 10, 15 minutes with the near infrared. Deeper areas like your hip, you might want to spend 5 minutes of the red and maybe 15 minutes of the near infrared because you got to go much deeper. So the same thing around a knee. I'm going to suggest you're going to spend, you might want to even spend on the upwards of half an hour around the knee with a good 2/3 of the time, 3/4 of the time with the near infrared, because the near infrared will penetrate much deeper. And as far as time, my suggestion is to do it 2-3 times a day. You know, how often do we get hungry? We like to eat 3 times a day. What about those cells? Would they not be interested in getting fed 3 times a day? And I can't imagine a cell being happier than if it's fed well and it's kept right up to, you've given it full octane fuel, a high octane fuel 3 times a day. It's going to do things better. And I seem to see that with situations with different people with chronic or acute issues. They just seem to get better faster if they do it more often. Now, the only time I suggest you really limit the time is if you are very sensitive for some reason. You're one of the ones that can't handle any EMF, or you can't handle a perfume or something like that your system is just on the very, very edge. We'll start a little slower. Just start a little less time with your treatment time. So that is key. And then ramp your way up. Do more and more each day. But definitely below the neck, I usually talk about you can treat longer than what we're recommending. Just if you want to get something to happen, depending on the thickness, if you only are talking of your hands, a couple minutes of red, 2 minutes of the red, and let's say 4 to 6 minutes of the near infrared, you're going to get really good things happening in that because it's not very thick. But when you're talking your shoulder, your hip, or your knee, you're going to have to spend a lot longer. Okay. Al is asking, my diabetic retinopathy is gradually becoming worse. I have a Super Palm 1050. Can it help with stopping or even reversing this condition? If so, is there recommended protocol? Everybody is different, okay, with every treatments of all kinds. But I will say for eye wellness, we have had people improve with diabetic retinopathy. As a matter of fact, there's 2 people that were, both of them had total blindness out of this. One was just a short time, and they used the light. And the protocol is with the eyelids closed, 1 minute of the bright red and 1 minute of the near infrared on each eye, and start with 1 time a day and then increase it over the next few days. But we got one person, diabetic retinopathy in Colombia, and I know the cousin directly. She treated her cousin, the guy, and he was 3 years total blindness. And now, after a few treatments, he was starting to see shadows, and then he went away somewhere and then came back and got a few more treatments, and told her she was wearing a blue dress with white flowers on it. And so he was actually seeing, and we have a video now of him driving a motorcycle down the street and turning around and coming back. And I don't know when you guys have ever seen somebody blind driving a motorcycle, but he didn't take anybody out. So in the process, but no doubt he's been able to recover his ability because he's now gone back to being a motorcycle mechanic. So hey, there's another woman that just due to retinopathy, not diabetic, but retinopathy, she was blind for a whole year, and she did that treatment in 10 days. She was able to see her daughter's face again for the first time in a year. So it's possible to change even eye health. We've seen that for different issues. Okay, we're seeing the time roll along. Okay, 660 or 810. Question was asked 660 or 810. I use both 660 and 810 nanometer. It's beautiful. The 660 maybe it doesn't penetrate as deep and gets highly absorbed by the blood, but then again, the near infrared can go much deeper, so it can get down to the joint. In all these cases, we use both wavelengths, the red and the near infrared, which is either 810 or 1050. Yeah. Okay, it's Ronald is saying it sounds like the red light device is positioned over the pancreas area. That's what it seems like. I mean, obviously, we're going to have to find out a lot more. And if anybody is independently wealthy and wants to fund a study for us and help us, you guys wouldn't mind, right?
Not at all. We'd be more than happy to get them signed up.
Yeah, we would love to have the help. That's
Or
for sure.
if they know a 501c3 that is interested in that, we'd be interested in talking with them as well.
Okay, all right. So definitely thought I'd mention that because we got some good stuff happening and we'd love to see bigger trials go because let's face it, we're gonna have lots of good anecdotal evidence that shows it works, but nobody will believe it until it's either themselves getting better. Sometimes they then they will believe it, or if it's their wife or something. But a lot of them, how is that supposed to do anything? Well, it does. It helps the light can be absorbed by the mitochondria, and as you mentioned, Jeff, there's 3,000 mitochondria in a cell or something like in the brain cell.
Well, there's between 5 and 10,000 per brain cell.
Okay,
The
5 to
heart
10.
has between 5 and 7,000. The
Okay.
other organs has about 2 to 3,000. The skin has, I think, roughly about 500 to 700. Fat has 200 to 300. And my finance background, I came up with 18 quadrillion mitochondria in the human body, plus or minus a quadrillion or two.
Wow.
And then, if I go back to thinking about textbook and looking at the mitochondria, this little bean that has the squiggly lines in it creates energy. I thought there was like one or two. So when I actually did a little research behind it, I'm like, holy crap, there's a lot of mitochondria in our body, which, you got, now I'm forgetting the math on it, 56, was it 56 trillion cells? Is that billion cells in the body?
So between 35 and 55 trillion cells, yeah.
Yeah.
So multiply that by,
by on average 1,500 to 1,000, because the derma, right? Is the largest really organ, I guess, or whatever you want to call it.
Right.
Yeah.
But it's averaging between 400 and 700. So,
Randy, we got another question here for you. For the 20-minute treatment on the pancreas, how long did you use the red and how long for the near infrared? How many times per week do you do the diabetic patients need this treatment?
So far, all we've done is once a week on each patient, just once a week. I use 20 minutes of red, and then we started with 5 minutes of the near infrared. That's how we started. And then Tom and I got to talking about that and how we could possibly see a better improvement. And I've only done this once So what we did was we went to 5 minutes of red to, for the blood flow and all that stuff. And then we went to 20 minutes of the near infrared. And so we're going to see how, and we did get a better result that time, but that's just one time. So I just want to make
Right.
sure that we're seeing that consistently, but that makes more sense to use the one that's going to penetrate deeper
Right.
for a longer period of time.
And what you found with the one woman with the camisole on, some fabrics are woven thick and or very dense,
Yeah,
and
so
it's
it's
going to be
diffracting the light.
harder for the light to get through. So very, very neat that you saw it firsthand. Yeah, so that's cool. Okay, let's see. You want to
Yeah, I
scroll
mean,
up a little?
the last time I checked, the reason why we wear clothes is to keep the sun off us in the summertime, right? So, it makes
Yeah.
sense. It refracts
Some
light.
of us wear clothes because it needs to be covered. I'm just
Well,
throwing that out there.
I resemble that remark. Yeah.
Well, as a matter of fact, there's some people that we both know that actually go in their backyard to get extra sun exposure for testosterone.
Testosterone, yeah.
Yeah.
Uh,
So the light does come in handy for that as well. That for
yes.
those guys out there,
Yeah.
you might.
Yeah, and he said his neighbors. It was not me or Tom
Yeah.
but it was somebody was on the phone. He says, "Yeah, my neighbors will appreciate me not being out there, get taking in the sun and all its capacity and glory."
Well, where I live, you'd have something frozen pretty quickly. Yeah, another quick. Hey, we got a couple questions. Can you guys hang in for a few more minutes?
Sure.
Sure.
Okay, all right. We got a couple more questions to answer. Couple more. Oh my gosh, a bunch of new questions. Okay, we'll limit it to another 10 minutes here, maybe. So, Patricia's asking, my question may be unrelated to your areas of expertise, but I will pose his question in case you could direct me in the relevant information. I am looking for any information you might have on kidney function and how the red light therapy might reduce creatinine levels in the 215 range. By the way, we saw somebody, again, anecdotal, that it really improved their kidney function by this. And did you say there was somebody that had an improvement on their kidney function or not yet?
So we've seen multiple patients with just our IRT treatment have improved kidney function, incredible improvement. We've seen people that were stage 5 actually move, that was getting ready to go on dialysis, move back into 3B. So we've seen some pretty impressive stuff with that. I have not looked at it in conjunction with the red light yet, but that is going to be part of what we're going to do. Our first study will be diabetes, and then and seeing it move that A1C, and then out of that we'll roll out. Okay, so what is it doing for blood pressure? What's it doing for retinopathy, for peripheral neuropathy, kidney function, EFR, creatinine, that kind of thing. What are the other pieces that'll come from that? And we'll try to catch all of those. We'll catch all the labs while we're doing that, and we'll see what it shows. But then we'll go specifically to that. If it were me, I'm not, anybody's, medical provider on here. So you talk with your medical provider about what you should do or you think you should do. But if it were my mom or dad or me, I would just put the red light on for about 5 minutes, and I'd put the the infrared
Near.
for probably 10 to 15 minutes, and then just kind of work my way up to see how it did. With a creatinine of 2.15, you should already be seeing a nephrologist. Typically 2 is the number that you want to just get on the nephrology's radar. So again, that's just, not anybody's provider on here, just throwing that out there. That's something that you should talk with your provider about. But if it were me, I would put it on me with the red for about 5 minutes and probably the near infrared for probably 5 to 10 minutes to start. And
Exactly.
then just work my way up and see how it does.
Yeah.
And then let us know, because we'd be very curious what's happening there.
Yeah.
And if you get in touch with Tom and his team, they'll get you in touch with us, and we'll let you know where we have clinics that may be able to help you as well. So just let us know.
Okay, and another other question here. Russ is asking, or Russ, about the video quiz that you sent me. I just haven't had a chance to get there yet. I'll have to have a look. An internal question here. Okay, Tom is asking, what about macular degeneration time to treat? So 1 minute red, 1 minute near infrared with the eyelids closed, everybody, eyelids closed. 1 minute, and the reason being of the red and 1 minute near infrared. The reason we close the eyelids is that the eyelids then diffuse the light coming in, so it's super even over the back of the eye. We've seen also with improvements in, well, actually, two people they had cataracts in both of their eyes. They had surgery on one. The timing was such that they needed cataract surgery for the other side, but they happened to find out about our light. Both of them used our light, and both of them didn't need surgery on the other eye because the cataract disappeared. Very interesting. Just
Actually
how
broke
that worked.
down the protein.
We've also seen with glaucoma, pressure in the eye improvement. Randy and Jeff, I want to thank you so much for coming on tonight. That was fantastic. I hope
Thank
a
you.
lot of people learn about this out there. Any final comments that you have?
Well, thank you for allowing us to be on here. And Randy is on vacation. Thank you, Randy, because he's the actual rock star. I'm just the finance major that it throws out crazy ideas, and Randy either shoots them down or says, "Hey, that might work." So I appreciate him and his partnership, and Tom, appreciate you give us a chance to share about what we're doing with IRT and Restore Via, and what's going to be a really beautiful and powerful relationship with SunPowerLED. So thank you.
Thank you. And yeah, thank you guys. This was great. And I'm sure that, and again, anybody out there that might think of a future clinic, these are the guys to talk to. Okay. And just one final one. My sinus problem went completely away, just to share this, everyone. She had some kind of sinus problem. Yeah, people have used it for sinuses. Anyways, good night, everybody.